Hello, it's Dr. Boulis. Today I'm going to answer one of the common questions that came to me through the social media or through the emails, which is the possible side effects and nodules forming with using the COVID vaccines if you have any dermal fillers in your face. First of all, I just want to say here that having those nodules or have this swelling, that this is something that can happen even without having the vaccines. If you read carefully the consent that we give it to you before we start injecting you, you will see, if you read really carefully, you will see that there is a possibility of nodules forming, and this is what can happen. Not a very common thing, but not uncommon. I personally had 3 cases over the last 3 to 3 years. I had a person who had some hard nodules here in her cheeks. Somebody else had it around her chin, and another person had it under her eyes. So late onset of nodules, it's a common thing that it's a possible thing, I would say, not really common, but it's a possible thing that can happen with injecting fillers, and it doesn't have even to be combined with the vaccines. But why this nodules can happen? So I'm gonna talk about it first, if it happens by itself before the vaccine, and what the vaccine can do for those side effects to be more common. So generally speaking, when we inject you with hyaluronic acid, we inject you with, although it's a hyaluronic acid and it's a sugar molecules, and it is nice and FDA approved, and it is good for everybody. I've been working with fillers for the last 14 years, and I'm so happy with the results, and my clients are happy also with the results. So what happened? They are still something exogenous. This is not something that exists in your body. It's something we added to your face. So it is still something that it's exogenous. It's a strange thing that happens to the face. And what happened here is your immunity system uh, can say, okay, I'm fine with it, I'm gonna live with it, it is, we're friends, I have no problem, I can let it sit there, integrate, and it does its job, which is volume replacing, replacing the volume loss. And also, as you may all know, and you may all notice, that fillers are amazing collagen stimulating substance. So when we inject it, it's even a treatment for your face that makes your face looking more hydrated and more plump, and it stimulates collagen production. And in certain cases, the immunity system will say, oh, listen, what is it? This is not something that, this is not me, this is something strange, and this is something exogenous, and this is something I think I should talk to myself, I should defend myself. I shouldn't say, oh, we're friends. I should just say, okay, who's attacking my face, who's attacking my body? So the immune system start to work as if it is a strange thing, or it's not a natural thing. And this is where this can happen. So in the cases that I had in the past, again, if this is something that, if you were my clients, I always tell you what kind of fillers I'm using, and I explain to you that there are different personalities. For each line has different products, and those products are good. This product is good for eyes, this product is good for cheeks, lips, etc., etc. So one of the things that I used to work with in the past, I was really using it a lot. It is a Juvederm line. Please don't take me wrong. I'm not attacking this line. It's a good line. I did work with it for so many years. But this line it offers 2 kinds of technology. There is a technology that's called high cross technology, and there is another one is called Vicross technology. So what's the difference between the Hycros and Vicros? So the Hycros, there are two products in the lines called Juvederm Ultra, Juvederm Ultra Plus. And there is another technology which is called Vicros technology, that is anything start with V, like Voluma, Vobella, Voleft, Volox. So what is the difference? The difference in the shape of the molecules, of the hyaluronic acid molecules. And it's complicated. I just want to make it in a client language to make it really easy for you guys to understand it. This is a special formula, and this is special technology, and this is a different technology. But I found, and even not me, it is written in every, like some studies, that the Vicros technology, they are more prone to form those hard nodules than the Hycros technology. And actually, the three cases that I had, they were injected when two with Voluma and one was Vobella. So for this, I kind of backed off a bit from the V or the Vicros, and I started to use what was the advantage when the company was trying to make us use this one, which is a great one. I injected so many people, you know, compared to three cases. This is nothing. I'm injecting kind of back to back every day. So the difference is the Vicros technology, because it's kind of tangled together in the molecules. The company claims that it lasts longer, which it does, but I would form my opinion on if even I will use something that it lasts less longer or shorter duration, but has less possibility of forming the nodules, I would still take it. Better than dealing with 1 in 1,000,000, you know, nodules. I can just say that one of the cases that formed a nodule was last year's, actually 2 years ago, and she texted me Christmas Eve, and she said, "Oh, look, I have hard nodules in my chin." And I was, at this time, I was visiting my son in Detroit, and I said, "Oh my God, I'm not here. I'm not in Canada. What am I gonna do?" And I started to talk to her, and I called prescriptions for her, which I'm gonna tell you how we treated it. But it's still something that you don't want to hear as an injector. You do not want to hear, and as a client, of course, you do not want to get, of course. But if it happens, this is fine. If you have any procedure, if you go to surgery, they tell you, oh, at the surgery you can have bleeding, you can have infection, you can have a clot in your lung, a clot in your leg, but you still go for the surgery, taking the advantage or weighing the advantage versus the disadvantage, which is something that we're gonna talk about again when we combine the vaccine with the fillers. Anyway, so back to my subject here, which is when nodules can happen, it can happen even without the vaccine. But when the vaccine, when we get the vaccine is kind of stimulating or triggering your immunity system to say, okay, look, there are stranger things here that can be in your body, work against it, defend the body. So exactly, and sometimes the immunity system is not smart enough to understand that this is not a virus, this is a filler. So this is why the vaccine can trigger the immunity system to act against the fillers and to form the nodules. But what should we say? Should we not take the vaccine? Of course not. I am a very vaccine person. If I like vaccines, even when I was a family physician, I used to encourage my patient to take their vaccines, their flu shots, their kids to be vaccinated. Vaccines are a great thing that can protect us, and no matter what are the side effects of the vaccine, it is way better than the actual disease. So I would take the vaccine. If I have, and I personally have fillers in my face, of course I have fillers in my face, you all know that. But do I get scared that I have fillers in my face and I'm not gonna take the vaccine? No, I'm not gonna get scared. It is a rare thing that can happen, and if it happens to me, I know how to deal with it. We don't have to dissolve it, the fillers. We can just deal with the fillers. We can, I personally, with the 3 cases that happened, I injected them with, I gave them prescription for cortisone, and I started with 50 milligram over a week, and then I started to taper them over 2 weeks or 3 weeks, so give them less dosing till I reached 10 milligram or 5 milligram, and I added some antihistamine like Benadryl. I added some anti-inflammatory like an Advil 600 milligram, and I didn't have really to do anything except in one case it was so stubborn, and I had to inject with cortisone. And again, it was resolved and everything was fine. The client did not lose the volume from the filler, and everything went okay, which is something I was able to deal with. So here is the question: if I have fillers in my face, should I take the vaccine, yes or no? I would say yes. Even if this rare thing happens, we know how to deal with it. I've read something, was a suggestion by a dermatologist, said if you had fillers, don't take the vaccine within the 2 weeks after you had fillers. I don't have any scientific fact to support that, but I can say it's a valuable suggestion. We can take it in consideration. Nothing really scientific. I would say that there is something was done or studies, whatever, that can confirm this fact, but it's a suggestion for all our safety. I would take it in consideration. If you did like this video, please share it and subscribe to our channel. And if you have any question or comment, please write it down under the video. I would be more than happy to reply to you. Dr. Boulis in Newmarket. Thank you for listening.